Gabriela, what happens when someone suffers an ischemic stroke?
So an ischemic stroke is caused by a clot. The clot prevents blood to be delivered to the brain. The brain depends on its arteries to deliver blood containing oxygen and nutrients up towards the brain to kind of feed those brain cells. Whenever there's a clot blocking that, the brain doesn't receive what it needs. And it can cause cell death, and this happens in just minutes. So it's very important for you to seek medical attention when you have signs of stroke.
And obviously those seconds are ticking away. What is happening to the body? And it affects everybody differently, right? In terms of what the damage can be?
Correct. So the effect on the body depends on the area of the brain that's affected, not so much the type of stroke. Depending on what tissues are damaged is what's going to happen as far as the deficits that occur in the patient. All
right, and we're going to talk more about some patients that Gabriela has seen and she has worked with one-on-one. We want to now kind of give you an idea of what a hemorrhagic stroke is, and we have a graphic, and I'm going to have you take this on for me, please, if you don't mind, and let's see if we have this graphic. Do we have one of a hemorrhagic stroke? And possibly there we have it right there. So, Haronyd, what happens here?
So in a hemorrhagic stroke, what happens is there are weakened blood vessels within the brain cavity that are ruptured. So bleeding occurs. And since this is an enclosed space where we have the brain, then pressure is added to the cells, and that causes damage as well. So it can be that with that increased pressure, they have to make, again, decisions in seconds as to how to relieve that pressure.
And you've seen, obviously, patients with both of these strokes, ladies.
Correct.
I know it's kind of hard to just, give examples, but everybody, again, is different. What have you seen, Gabriela, when you see that happening?
Right, so each lobe of the brain controls different functions within the body.
Sure.
So it really depends on which cells are affected. They're not getting the oxygen they need, so those tissues are dying off, so they're not able to function and control whatever area they're responsible for within the body. You might see paralysis, loss of movement, difficulty understanding or speaking, difficulty with swallowing, memory issues, thinking difficulties. These are all things that can happen as a result of a stroke.